So, starting off, again, you have your, usually covering it, you have your pericardial sac. Just kind of peel that back. You have the lungs on either side. And then right here, you have your coronary vessels. Now, once you find the coronary vessels, you know the right from the left side. So this is the right ventricle. This is the left ventricle. That's the apex of the heart. Right atrium, left atrium. Now, between the right and the left atrium, there are two major structures. You have this, so the right ventricle comes up, it ends right about here, and then everything right there, that's the pulmonary trunk. Carries deoxygenated blood out to the lungs. If you take this ventricle, or sorry, the atrium, and push it off to the side, coming up right underneath it, right here, that's the ascending aorta. It has that little characteristic piece of fat on it. Here's the aortic arch. And aortic arch ends right here, and now you're looking at descending thoracic aorta. Coming off of that descending thoracic, you have the lumbars. Coming off to the ribs. And coming back up to the aortic arch, you've got the brachiocephalic artery and the left subclavian. Brachiocephalic artery bifurcates again as the left common carotid that runs the whole way up here, and then it branches again. So you look for where this vagus nerve comes down, and right there you can see how there's a little branch. I'm kind of under it right here. That's the internal carotid. Everything up from that is then external carotid. So all that's external. Everything in here, that's internal carotid. And this one right here, it's kind of obvious, that's the lingual. It runs over to the tongue. So that brings us back to the vagus nerve. Then we have the trachea. Sorry, the larynx, the trachea, and below the trachea, you have your esophagus. So there's the esophagus right there. Also, salivary glands right here. Now, come back down, let's take a look at the veins. Right below, there's the inferior vena cava. Here's the superior vena cava. Superior vena cava comes up and it branches kind of like a Y. So this should be like that. But it tore. But this is the right and the left brachiocephalic vein. Brachiocephalics then branch again, and right here I can see it. It's got a little bit of blue right here. That's actually the internal jugular. It runs kind of parallel to that carotid. In other cats, it'll be real obvious. Okay, now right here, before it passes through the thoracic wall, that's the subclavian vein. And then you're looking at the axillary, brachial, and a little bit of blue in there, that's the radial. Now, as far as the subclavian artery, axillary artery, brachial artery, and then right here, there's the radial right there. Okay. Now, all the white strings around all this, it's another nerve bed. That's the brachial plexus. So brachial plexus, and then you have the axillary arteries and veins. Now this cat's missing the external jugular. It normally comes up. You can see where it is, but it's not stained. So right there's external jugular, and normally cats have a transverse jugular that this cat is lacking. That's all of them.